If you have bipolar disorder or you love someone who does, I'm going to talk about some treatment strategies in this video that you may have never heard of before, but which you probably should be interested in because it can provide significant decrease in symptoms and decrease in flare-ups without side effects. So stay tuned for this. I'm Dr. Kimberly, a family physician. I've been taking care of people with bipolar disorders for years, working hand in hand with their psychiatrist to refill their medications and monitor their current status. But I did not know back then what I'm about to tell you in this video. So let's check this out. Most people with bipolar disorder of whatever flavor think that there's something wrong with their brain or their brain circuitry or their brain neurochemicals like norepinephrine, serotonin, and dopamine. More and more research is not supporting these hypotheses and pointing more and more towards a metabolic cause, a disorder with how the brain processes glucose or insulin, or that the brain is inappropriately inflamed, or that the brain is just starving for ketones. And the things I'm going to tell you about in a moment directly address all of those potential causes. Now, let me say right up front, do not stop taking any of your bipolar medications based on the advice in this video. Talk with your mental health care provider and establish a plan. After you've been doing the things I talk about in this video for a few months, talk with your psychiatrist or your healthcare provider and say, hey, I feel better. I don't think I need this much medication or this many medications, and work out a plan with your healthcare provider to decrease or stop any medications. Now, almost certainly childhood trauma or drama can increase your likelihood of developing bipolar disorder. But more and more researchers are coming to see that maybe it's not what happened to you in your childhood. Maybe it was what you were fed in your childhood. Maybe it was what your mother ate while she was pregnant with you and you were in the womb. But definitely trauma and drama, either in childhood or early adulthood, probably play some role. Indeed, also genetics probably play at least a small role. But more and more, once again, researchers are saying maybe it's not what you genetically inherited from your parents. Maybe it was how you were taught to eat, how you were fed by your parents, because that also runs in families. So many brain researchers, most doctors, and almost all patients think that their brain runs on glucose and can only run on glucose, which is what you get when you break down carbohydrates and starches in your diet. But more and more researchers are starting to understand that bipolar disorder, along with many other mental health disorders, might very well be caused, or at least worsened, by a disorder in the brain's ability to utilize glucose or insulin. And it could also be caused by chronic inappropriate inflammation in the brain that's coming from an improper diet that you've been eating, maybe even a diet you were told that you should eat. Also, mitochondrial dysfunction in your neurons is increasingly being looked at by researchers, saying, maybe it's the diet they're eating that's not fueling the mitochondria appropriately, and that's leading to this patient's bipolar symptoms. So let's talk about the 5-step plan that I want you to consider. I want you to research it. I've included a lot of research links down in the show notes. There's a lot of research going on right now about using a very low carbohydrate diet, a ketogenic diet, or even a carnivore diet to improve, or in some cases completely reverse, the symptoms of bipolar disorder. So I'm going to give you these 5 basic, easy to understand steps that you can start to implement immediately at home. But remember, don't stop medication until you talk to your doctor. So step number 1 is to adopt a real whole food, 1 ingredient ketogenic diet. There are multiple research studies already on the books showing an improvement in bipolar disorder symptoms with a ketogenic diet. And there are scores of research studies going on right now looking at the power of a ketogenic diet to decrease the symptoms of bipolar disorder, or in some cases to seemingly put it completely into remission. Now, I have multiple videos on this channel about how to start a ketogenic diet, and I'm going to link to my ketogenic playlist 101 down in the show notes. If you're like, I don't know how to eat keto, how do you even start that? I got videos in the show notes that'll help you understand that. The second thing that there seems to be some research to support is that your gut bacteria actually play a pretty large role in your overall mental health. So either by eating a diet that makes your gut select for mental health healthy gut bacteria, or adding a very high quality probiotic to your diet, is probably going to lessen your bipolar symptoms, at least to some degree. The next thing, number 3, is to greatly increase the amount of omega-3 fatty acids that you're getting in your diet. Now, I'm not so much talking about ALA that you get from plants. I'm talking about EPA and DHA that you can only get from eating animal-based foods, fatty ocean fish and fatty butter, fatty egg yolks that are pastured. You can actually get tons of omega-3 fatty acids from your diet. Now, if you just don't like any of the foods that I talk about in my omega-3 rich foods video, then you could consider taking a very high quality omega-3 supplement, but I'd much prefer you get it from foods. And omega-3 fatty acid rich foods are absolutely part of a ketogenic diet. Number 4 is to make sure you're getting all of your B vitamins. And there's a long list of B vitamins, and you can get them all from the fatty red meat and eggs that come in a ketogenic diet naturally. Now, if you're going to take a B vitamin supplement, I would highly recommend that you take a methylated B complex, just in case you have the MTHFR gene mutation. That way you're able to use those vitamins and not just pass them through in your waste. Then step number 5, it's kind of a summation of what keto is, but I want to say it more blatantly so you really understand the 4 basic steps of starting a ketogenic diet. Number 1, eliminate all sugar from your diet. Definitely any added sugar, but also too much sugar that occurs naturally in the foods that you've been eating. Step number 2 is to eliminate all grains from your diet. Wheat, rice, oats, corn, definitely eliminate those. Because they're full of sugar. The starches in them break down into sugar immediately. And if your brain has a problem metabolizing sugar, or has an insulin problem, or even has an inflammation problem, or a mitochondrial problem, the sugar from the grains is going to muck up the machinery that's trying to fuel your brain. And then step number 3 is to eliminate all vegetable seed oils from your diet. Canola, corn oil, soybean oil, safflower, sunflower. These are all unnatural oils that human beings have only been consuming for about 150 years. I want you to eat the ancestrally appropriate fats that humans have been eating for millions of years, like butter, beef tallow, bacon grease, chicken fat, sheep's fat, duck's fat, goose fat. These are fats that humans have been eating for millions of years. And if any fat is going to be recognized and used properly by your brain and by the mitochondria in your neurons, it's going to be this ancestrally appropriate fat. And then step 4 is to increase the amount of fatty red meat and eggs with the yolk to your daily diet. I wouldn't worry so much about heart disease and cholesterol and all that other stuff. If you are worried about that, I've got videos on this channel that will help you understand what your true risk is of eating an ancestrally appropriate human diet full of fatty red meat and eggs with the yolk. The medications used to treat bipolar disorder, both FDA approved and drugs that are used off-label to treat the symptoms and the mood disorder of bipolar, have a very narrow therapeutic index, number 1. So it's very easy to be either taking not enough to get the benefits or taking too much and then getting all of the horrendous side effects. The best example of this is lithium. If you get the dose exactly right, it can help your symptoms significantly. But it's very common for someone to be taking not quite enough and not getting the benefits, or to take too much and have all the terrible side effects. Many things can change what your therapeutic index is for lithium, from stress in your life, from your current diet, if you're not sleeping enough, if you're not getting enough sunlight. Many things can affect that, including other medications and supplements. So if you're taking anything else, that can also swing your lithium therapeutic index wildly out of control. Then there's a lot of anti-seizure medications like carbamazepine, valproic acid, divalproex, and lamotrigine. Again, very narrow therapeutic windows here. They can offer you some benefits, but the side effects of both lithium and the anti-seizure medications can be almost disabling, almost in some cases as bad as the bipolar symptoms themselves. And then many doctors will add an antipsychotic like Abilify, Latuda, Zyprexa, Seroquel to your lithium or whatever else you're taking for bipolar. And the additive side effects of all these medications together can, again, be just as disabling as bipolar disorder itself. So if you're able to adopt a therapeutic, very clean ketogenic diet or carnivore diet and decrease your bipolar symptoms enough that you can decrease or stop some of these medications with the help of your doctor, just imagine the benefit in your overall quality of life, in your overall mental health, if you're able to treat at least part of your bipolar symptoms with food, not only the foods you add to your diet, but the foods that you take out of your diets. And you could come off 1, 2, 3 psychiatric medications for your bipolar. Imagine the benefit, imagine the improvement in your overall health and well-being. New studies are coming out almost daily showing that a ketogenic diet improves the amount of therapeutic ketones that are in your blood supply and thus available for brain function, that a ketogenic diet improves mitochondrial function, and then also decreases chronic inappropriate inflammation all over your body, but in this case, especially inside your brain. So I hope that you'll check the research links down below, have a conversation with your mental health care provider and say, hey, human beings have been eating a low-carb, high-fat diet for millions of years. Let's try this together as a team to try to improve my bipolar and maybe even get off some of these medications. Now, if you're part of a bipolar Facebook group or other social media group, I would highly please beg you to share this video on that page or in that group. You'll find two things. First of all, you might actually help someone substantially improve their bipolar disorder, but what you might also get is before and after stories saying, hey, yeah, I tried keto and it helped my bipolar disorder tremendously. So please share this video and check out the research links in the show notes below. This is Dr. Barry. I'll see you next time.